I'm Dr. Paul Callaway. I am the program director of the Wesley Family Medicine Residency program in Wichita, Kansas. I'm a clinical professor in the Department of Family and Community Medicine at the University of Kansas, Wichita. I am involved in executive discussions with the hospital medical system, the medical school, and even nationally in large organizations that help shape curriculum for family medicine education in the country. I was immediately intrigued with the whole process of PCM and its application to me personally and professionally. As I learned about this technique, about this model, it was clear that there were certain personality styles that caused the conflict that I was experiencing. I was coming from a persister workaholic base, and residents that I worked with that were coming from that same pattern. We communicated very well, we shared values, but when I began to work with people, particularly from rebel and promoter base, I could not understand where they were coming from. And that conflict is ultimately what led, again, to the desire to learn a new way to react with this personality type. In distress, I become very judgmental and very preachy, and that really fails to achieve the desired outcomes when I'm giving a do better talk to a particular resident or faculty member. And by recognizing how to motivate and engage different personality types, it's been dramatic in the change of how I communicate, how I plan meetings, retreats, discuss differing points of view in curriculum and educational style. So it has been transformational would be a reasonable word. If pimping is coming from an attacking stance, it virtually never does anything but send the resident into distress. On the other hand, if I approach that same clinical inquiry about why they are doing, what their level of understanding about the basic physiology, anatomy, pharmacology, whatever, and then the application to the patient that's in front of them. When I engage them in a way that they understand that communication style, we get a much richer discussion of the patient, of the problem, and they express a significant amount of appreciation for the interest that I have in trying to help teach that problem. Another area where I believe that PCM has benefited me professionally for sure, but also personally, is in my written communication. I spend a lot of time communicating with the hospital, with the medical school, with people in the national education community, residents, faculty members, etc., through email and through other written documents. Prior to PCM, I had no idea how my style of writing would often disengage the reader. And as I look at various listservs that I'm on, you can pick out the people that are in distress just by the length of the writing, the choice of words, and I have often been envious of people that could capture their ideas in a very short amount of words and be very effective in communication. And I realized that by applying the PCM process to the written document also helps to engage the reader and communicate the point that I'm trying to make. Prior to taking a role in academic medicine, I spent 10 years in private practice. And as every physician can tell you, you can look at your schedule for the day, and certain names automatically send you into distress. You see that name and you know that is a patient who you're going to have a difficult time getting out of the room, you're going to have a difficult time communicating or addressing compliance issue and chronic disease management. And as I look back now, after PCM training, I begin to realize that many of those patients that caused me so much distress as a clinician were pushing the personality buttons, if you will, that I had, that were getting me into conflict with the patient. And now what I've seen in my work with the patients that I do see now and in working with residents, being able to engage the patient in a language that they understand, a language that they speak emotionally as well as just from the words and the text. It improves compliance, it improves the value of the relationship, and it leads to a much improved doctor-patient relationship. A realization that I had is that the two personality types that are the most difficult for me personally and professionally have been the rebel and the promoter. This comes from, again, my strong persister base, but the rebel wants to play, and as a persister, play is the reward for hard work and a job well done. And so to be able to play before you do work is not in the just the natural mindset that I have. The promoter wants to make a deal, cut to the chase. They can come up with solutions and save the day when nobody else can come up with a plan. But again, as a persister, it has to be done with the right motive. It can't just be solving it. It's got to be the process. And so this obviously would put me into conflict with these personality types. Recently, we've had, again, as a national issue in education, the Accreditation Council for Graduate Medical Education has issued new duty hours that will go into effect July 1 of 2011. And everything that we did with our curriculum, with call schedules, with how residents worked shifts and handed off patients, things had to be dramatically changed. And we wanted to have something very unique and special in our program that was not just looking like every other program in the country. One of our residents who has incredible promoter strengths and personality type was literally able to come in and create a model that myself and the rest of the faculty looked at, scratched our head, and we were dazzled. We thought, this is ingenious. And he came up with ideas that none of us would have ever come up with. And again, it just, by using his promoter strengths, we were able to really come up with a model that's going to be beneficial to our program and I think potentially be a national model for resident education.